Hi, my name is Michelle and I'm a student nurse at C&M and I've come to give you a head-to-toe assessment. I have provided for privacy, I've gathered all my equipment, I'm washing my hands, I'm checking my physician's orders. Beep, boop, boop, boop. Could you tell me your name and date of birth, please?
Steve Poyani, 5 May 1966.
Excellent. So I'm here to give you a head-to-toe assessment. That means I'm going to start at the top of your head and have a bunch of tiny assessments all the way down to your toes. At this time, on a pain scale of 0 to 10, 10 being the worst pain you've ever felt, and 0 being the no pain at all, what pain level are you?
0.
All right. And do you know why you're here today?
Assessment.
And do you know what today is?
Friday.
And do you know where you are?
At the clinic.
At this time, how is your general health?
Good.
Good. All right. Do you have any chronic illnesses?
No, I do not.
Do you take any prescriptions or medications?
No, I do not.
Do you take any over-the-counter drugs, ibuprofen, Tums?
No, ma'am.
Do you take any herbal tinctures or
No, ma'am.
cures? All right. Patient is ANO 5'4". I'm going to start at the top of your head. I'm going to work my way all the way down. The first thing I'm going to do is palpate the top of your head. Please let me know if there's any tenderness. Any tenderness?
No, ma'am.
All right. The second part is a facial. Go ahead, give me a smile. Turn this way. Give me a smile. All right. Give me a frown. Puff out your cheeks. Stick out your tongue. Up, down, left, right. All right. Raise your eyebrows. A patient has facial symmetry. The next part is go ahead and take off your glasses. I'm going to measure your eyes. Your eyes are at a 6. A 6. So I'm going to do a test on you. Go ahead and take keep your eyes on that light over there. Cover up one eye. Uncover. Other eye. Uncover. Up. So go ahead and keep your eyes focused up there. I'm going to move my pen light in front of you and just go ahead and focus on that. Ready? Go. Patient is Perla. The second part is 6 fields of gaze. Go ahead and turn this way a little bit. So keep your eyes over here and just follow it with your head. I follow it with your eyes and not your head. Six fields of gaze are intact. Go ahead and pull down your lower lids for just a second. All right, that's enough. Conjunctiva are pink and moist, and your sclera is white with some bloodshot. So what I'd like to do next is, the bed is at a 45-degree angle, but if I remove this pillow, his head's going to fall over. So go ahead and turn your head that way, and turn your head this way. All right, go ahead and straighten back out. No JVD present. Skin turgor less than 2, which is fine. And I'm going to feel your carotid arteries. Carotid arteries +2, regular rate and rhythm. Go ahead and turn this way. Feet hanging over this way. Wash my hands again. All right. I am going to do a visual back inspection. Some moles, some freckles, no tattoos, no scars. I'm going to palpate. If at any time you feel tenderness, please let me know. Any tenderness?
No, ma'am.
All right. We're going to do a chest excursion. Take a deep breath. Chest excursion symmetrical. Say 99.
99.
Say 99.
99.
Say 99.
99.
Fremitus present. I'm going to listen to 10 sounds on your back. This is a 2-4-4. The first 2 are vesicular, the next 4 are bronchovesicular, and the last 4 are vesicular. Every time I move my stethoscope, give me a deep breath. If at any time you feel you're dizzy, please let me know. Deep breath. Posterior lung sounds are clear. The next assessment we're going to do is your lateral lung sounds. I'm going to listen to 4 sounds on your right and 3 sounds on your left. I'm going to go back and forth for a zigzag pattern for these vesicular sounds. Go ahead and put your hands on your head. If at any time you feel dizzy, please let me know. Deep breath. 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 Lateral lung sounds are clear in all lobes. I'm going to listen to your front lung sounds. There are 8 lung sounds. The first 2 are bronchial, the next 4 are bronchiovesicular, and the last 2 are vesicular. If at any time you feel dizzy, please let me know. Deep breath. Anterior lung sounds are clear. The next part is I'm going to listen to your 4 heart valves. The first one is your aortic. It's located in your second intercostal space, right sternal border. The second one is your pulmonic. It's located in your second intercostal space, left sternal border. Both of those are S2 sounds. The third one is your tricuspid. It's located in your fourth intercostal space, left sternal border, and the last one is your mitral valve. It's located in your fifth intercostal space, mid-colovicular. I'm going to stop there and listen for 1 minute for your apical pulse. Your apical pulse is 64 beats per minute. There were no murmurs, clicks, or rubs. I'm going to do a visual inspection of your chest. Some freckles, some moles. Palpate. Is there any tenderness?
No, ma'am.
No tenderness, no masses for your chest inspection. All right, I'm going to do a upper body inspection. Don't help me at all. So some freckles. You got freckles on this side. Let me know if there's any pain or tenderness. Any pain or tenderness?
No, ma'am.
All right, no pain or tenderness. I'm going to take your brachial pulse. Brachial pulse, +2, bilateral, regular rate and rhythm. Then I'm going to take your radial pulse. Radial pulse, +2, bilateral, regular rate and rhythm. Thirty times 2 is 60. Your radial pulse is 60 beats per minute. I'm going to do your capillary refill. Capillary refill, less than 2. Go ahead, push my hands, pull my hands, squeeze my fingers, strength 5 by 5. Visual, capillary. All right, so what I'm going to do is lower the bed to less than 20 degrees. For this, what I'm going to do is a abdominal inspection. I'm going to visually look at it, I'm going to listen to it, and then I'm going to palpate it. But before we start that, when was your last bowel movement?
This morning.
And was it loose or formed?
Formed.
And what color was it?
Brown.
All right, and for your void, when was the last time you peed?
About 2.5 hours.
And what color was it?
Clear to yellow.
Clear to yellow. Did it have any strange odors?
No, ma'am.
Was it clear, cloudy or clear?
Clear.
And do you feel like you emptied your bladder completely?
Yes, ma'am.
All right, let me do a visual inspection. Couple moles. I'm going to listen to your bowel, your sounds are normal active. Your belly is flat, no distension, and let me know if you have any tenderness. Any tenderness?
No, ma'am.
No tenderness at all. For your heart valves, A and P, your aortic and your pulmonary are your aortic and your pulmonary are S2 sounds, and your mitral and your tricuspid sounds are S1 sounds. All right, if you could turn over that way, I'd like to inspect your back completely. Some freckles, no scars, no tattoos. All right, go ahead, lay back down. Freckles, no scars, no tattoos. Freckles, no scars, no tattoos. Let me know if there's any tenderness. Any tenderness?
No, ma'am.
Any tenderness?
No, ma'am.
All right, no masses, no tenderness. Actually, let me lift your legs up just a bit. Let me palpate again. Any tenderness?
No, ma'am.
All right. I'm gonna do just spread your legs out just a little bit. I'm going to do your popliteal pulses. Would you like? I can't feel your right one, but your left one is +2 regular rate and rhythm. I will go get the Doppler for the other one. Your posterior tibialis. +2 bilateral regular rate and rhythm. Put your feet together. Your dorsal pedis, +2 bilateral regular rate and rhythm. Capillary refill. Capillary refill, less than 2. Nose, toes to your nose. Pedal to the metal. Arm wiggle your toes. Strength 5 by 5. I am lowering the position of your bed on a scale of 0 to 10. 10 being the worst pain ever, 0 being no pain at all. What is your pain scale?
0.
Do you need any possessions?
No, ma'am.
Here's my call light if you need me. Side rails are up. Skin turbine is good. I've got plenty of time. Oh, patient hears normal conversation.
Yes, I do.
Done your mouth. Now, your arteries. Skin. And your chest. S1 sound, S2 sounds. The first 2 sounds, the aortic and the pulmonary, are S2 sounds. The last 2 are S1 sounds. Normoactive. Some questions. Looked at your entire back. Did the sounds. Did all spaces. Looked at your legs. Palpated your legs. I think I'm done.